Before we donning the gloves, we have to have washing our hands. We don't donning the gloves on dirty hands. This is the worst sometimes because when I try to remove the gloves or change it, sometimes the microorganisms from dirty hands might go to the other patient, or I might touch the handle of the light and transmit it for other different stuff. Don't touch patient nose. It's very important. When you're wearing the gloves, don't touch the patient nose. Don't touch your face, the handles. Make sure everything. We'll talk about the disposable barriers to protect us from the MFC. The gloves must be worn while treating the patient, and immediately after finishing the treatments, we have to dispose them as a hazard waste. Don't throw them in the normal rubbish bag or bin. It is very important because still they have blood and some bacteria. Remember, hands are not necessarily clean because gloves have been worn. Because you thought I'm treating the patient, I'm wearing the sterilized gloves. When I change the gloves, sometimes out of blue I touch the skin. The microorganism from the external surface, it goes to the gloves for the dust. In routine dentistry, we can use this, the one we use it now is non-sterile. But all the gloves, disposable gloves, are manufactured in variety of the material and must carry the CE marking, denoting the acceptable safety level and performance. We can use any kind of the gloves because if not having this marking CE denoting the acceptable level, it might tearing off or punctured any times out of loop, or it might be made up from the material permeable to microorganisms. For that, in UK, we used to have these kind of gloves. And natural rubber latex gloves permit, as I mentioned before, manual dexterity, and they are impermeable to microbes, and they are a common type of the gloves to be used in clinical to protect all the face and body from the splashes of the blood and saliva. So goggle or fissures should be worn during all type of dental treatment. Choose the goggles or the face shield will give us advantage. We will never touch our face because it discourages us because we feel we're carrying like a weight on the face, so we avoid to touch this thing. The surgical mask, the important and the use of surgical mask protect the wearer from splashes, blood, saliva, and infectious substances, and protect the site of surgery from expelled like skin squamous cell, or protected from some respiratory droplets. Partial protection from respiratory pathogens like tuberculosis and influenza, flu virus. Mask should be worn particularly when using the ultrasonic scaler and high-speed rotary instrument. This is the advice. It should be changed after fixation. This is the point I need to mention as well, because in clinic I saw different of the dental worker or the patient or anyone coming here sometimes because the hot weather with disclosed feet. So footwear must fully cover the feet in order to protect from any material fall over on the feet, either the blood, saliva, or piece of amalgam or anything. It will make contamination for his feet. Surgery surface, I highlighted this point. It's very important because if you go to dental surgery or dental specialty, you will see the dental assistant try to use the transparent stickers. The question at the point of use these stickers. This is the answer. The dental surgery is a potential source of methicillin-resistant Staphylococcus aureus. This kind of the microorganism, it causes the abscess on skin. This vice versa, either it might be transmitted from the patient to the dental worker, or from the dental worker to the patient. Because the patient used to touch the handle of the doors, the operator or dental worker will touch the handle of the lights, the keyboard and the mouse and all this. For that reason, study by Whitaker 1991 and Putra 2006 suggests the surgical barriers. Concluding infection control, Dr. Khalid is everybody business, it's not my business only. And protect yourself, policies and procedures. Thank you so much.
Dental players, surgical players, forceps, and cures. I think most of you are familiar with these instruments. As you know, these instruments can penetrate the mucous membrane, can communicate with the blood, can communicate with bone and other sterile tissue. Okay? This makes this instrument a critical instrument because they have a high risk of transmission of the disease since they communicate blood. Okay? So, what do you think for the sterilization of this instrument? High risk. This instrument should be sterilized using heat sterilization, or otherwise we may use disposable instruments. Now we have disposable instrument, okay, that we have to change the instrument for each patient. The other type, which is the semi-critical instrument, mucous membrane, but do not penetrate yet. Okay? You understand the instrument is by low chemical immediate disinfectant. Okay? Now, we said that here some sterilization by him for autoclave. Who can tell me the temperature, the pressure that we need and the time of the device? نفس الجهاز مثل اي شركه بتشتريه نفس السوليوشن اللي بيعملوا له ريكومنديشن له. اوكي؟ This is actually the disadvantage of this type. But it has an advantage over the autoclave by first do not rust the instrument. Okay? Do not cause rusting or corrosion. Okay, you are with me? Because there are no steam here. It's chemical. Do not rust. Also,